Yes, so if you want to represent a state team or a national team or an international team, the first thing is that you.
How do you stay updated with the latest research in orthopedic and sports physiotherapy?
Yes, for this query, I would suggest one thing. As a clinician, we need to develop as a patient-centered approach. What your patient requires, give the treatment according to them, not that what you know and you are going to give the same to the patient. And you should develop your own image and own uniqueness.
Hello, welcome. And joining me today, Dr. Deepak Kumar Pradhan sir, who is having the 8-year clinical and sports experience in sports physiotherapy. So thank you, sir, for having time with us.
Yes, thank you.
So, sir, as a clinical practitioner in the field of physiotherapy, we have some queries and we would like to share your experience with us. Like, sir, in sports physiotherapy or in orthopedic, how do you stay updated with the latest research in orthopedic and sports physiotherapy?
Okay. It is like in orthopedic and sports physiotherapy when it comes to treating any condition or dealing with any patient, it is like how do you approach to a patient. So as you get your experience the day by day, what are you supposed to do? You should learn how to approach a patient. Like it is a multifactorial approachment rather than what patient is telling, what problem currently he has, rather than analyzing the whole factor what he has come up with throughout the year, how he has developed the pain and what kind of activities he does. And the best thing what are you supposed to do is finding the impairment specific. Impairment specific means like even if a patient comes to with a complaint of neck pain, back pain, or any other kind of disease, all the patients are not same. Though their complaint might be same, but their impairment could be difficult. So as a clinician, what are you supposed to do? You need to identify a specific impairment, so which will help you as a clinician to develop a impairment specific protocol or a homogenic protocol, which ultimately the patient would get benefit out of it.
Sir, like suppose we are treating the patient, many clinic there are different their systems. Like some are working with the packaging system, and some are working with daily basis session like this. So that time, sir, we have faced that problem that patient mindset while taking treatment in first session, like patient expectation and our treatment. How do you coordinate that thing?
Yes, sir. For this query, I would suggest one thing. Like in the first session, when our patient visits to a clinical or a therapist, what are you supposed to do? You have to do a consultation. And in the consultation day, what are you supposed to do? You can do a full body assessment and according to the current problem, what the patient has come for, identify a suitable treatment, what will be benefit for the patient. In terms of suppose the patient has come to you with the help of or with the complaining of knee pain. He is an athlete and he is complaining of knee pain while doing so many open or closed kinematic activities. So what you need to do, find out a suitable group of treatment which the patient would benefit of, like strengthening exercises, functional movement training, or taping or mobilization. So you can decide that on the first day, and you tell that you would require this many sessions, and after this many sessions of treatment, this would be your outcome. So at the first session itself, you will be showing the goal to the patient. This is your current problem, and after getting treatment of 7 days or 15 days according to your impairment, you are going to achieve this goal. So in that period of time, you can be specific to your treatment, what you want to give, according to you, what would be the best to the patient. And please make sure that you are making able to understand the patient, what is the current impairment of the patient and what the patient is going to achieve after your 3 sessions or 7 sessions or 1 month session of treatment. So in that way, you can deal with the patient and get them better out of it.
Sir, in your experience, how does the financial growth or earning potential of a physiotherapist working in a clinical practice compare to those pursuing an academic career in teaching or research? तो मतलब बहुत सारे स्टूडेंट का ये है एक्चुअली क्वेश्चन.
Okay. Yes, sir. So first of all, I would tell you that I am since my beginning of my career, I went to the academic, but till I was a student. I was happy to go to clinical, and I was already joined in a clinical setup, but because of some issues, as it was a government setup, but as they told that it will not be continued as a full time, so that is why I stepped down and I came to the academic. So if you want to have a comparison between academic and clinician, academic is a fixed time job and you would get a monthly amount which is fixed. Okay, but in clinician it is a range what you are going to get. from high range to low range that you can expect. So clinician, what would happen? Your reaching to the public would increase, and you will be self-dependent. You can depend upon yourself, and reaching to the public when it increases, then definitely day by day your reachability will increase and your income also will increase. In academic setup, you will be fixed to mind setup. So you are going to do this and you are going to sit in a closed chamber and do your work. But in a clinical setup, definitely this has some luxurious, or this has some advantages to get more amount, but simultaneously there is a cons as well. Like you have to increase your reachability through your service, through your communication, and through your approach. And you have to be patient so that your reachability can increase, and that day will come. You will get patients without having any references. So people, what they have like, sir, how will you get a patient even if you open a clinic? So it is like people will come because you can see the number of growth happening, the number of population are increasing, and everybody will require a healthcare help, especially physiotherapist help. And due to their hectic lifestyle and due to regular routines, it is they are very much prone to develop all this kind of disorder. So to get ailment of this, physiotherapy is the best solution. But the thing what we need to have is our approach, our communication, and our service to the patient. So if we have all three patients, all three things along with your persistence or patience, definitely you will get your own goal. And yes, definitely there is a comparison between what I would say, like if you talk about engineering background, like as soon as they get passed out, they are getting high package of salary for which physiotherapy is being compared up, and we are not getting it. But if you compare it after a 10 years and 15 years, the amount what they would be getting, and after 15 years what the physiotherapist would earn, it is definitely more than them. So in a long term, there is a benefit. Yes, you can say that immediately you may not get a good package out of it, but when you continue as a physical therapist or a clinician or an academician as a career, definitely at a set point of time you will be able to earn that much of thing. And even during the engineering field, what happens? They would be at peak immediately as a fresher, but when they get experienced, their value gets come down day by day. But for a medical professional, it is completely different. As a fresher, your value will be less, but as soon as you gain experiences, your value will keep on increasing. So definitely there is a pros and cons in each of the field. And as a physical therapist, you also can get name and fame along with your service and along with your approach to the patient.
So, okay. Then, sir, how do you see the field of physiotherapy in upcoming 5 to 10 years, and what challenges and what opportunities would come in?
Yes, sir. So here I would like to keep you one point, like you people would knowing about the market. So Warren Buffett, he is a businessman who has told that market will never keep sustain, it will be keep on growing. So what we have seen the market in the last couple of decades, last couple of years, day by day it is keeps on increasing. So definitely the future or the scope of any field, it will be keep on increasing. But the thing is how we are loyal and how we are honest and how much we are able to give service to the person or give service to the population, that would be important. But if you ask me like what would be the scope of physiotherapy, definitely it would increase. Nothing in the world it keeps sustained. It would be keep on increasing. It would be keep on increasing. But as an individual, what we need to do is we need to have patience. We need to keep flourishing with our skills and with our approach to the service.
Sir, can you share your insights on importance of research publication for physiotherapy students? How does it impact on academic and clinical career?
Yes, this is also one of the aspect how your service can reach to the patient. So even though you have some kind of approach and this approach you follow to give service to a patient, but what currently has been approached by the other clinicians or the other therapists, that is one thing, that is one magic key which will give you the thing is the research. So research, what it will help you. It is like it will tell you how you can update yourself and what is the current trend of practice. Current trend of practice. Even though your practice gives a good result, and if you follow the current trends or if you follow the research, you may get a better result out of it. So definitely we should be involving in research and we should be doing our research. As an Indian therapist or Indian mindset, what it is that we do hard work, but we don't publish it. Research is nothing but that doing something and not publishing. Research is all about doing and publishing. As an Indian mindset, what we do, but we don't publish. So that is the thing which we lack. So if you can be bit of smarter rather than doing all hard work, If we can do both smart work as well hard work, definitely the kind of work we do, we can publish it, and we will also let the world know that yes, this is the thing what we have experimented, what we have observed on our patient, and that the other part of the world can follow. But currently, what are we doing? We are following what are being followed by the other part of the world, because we are not able to do the smart work. We are completely believing on our hard work. So, but in today's area, what we need is hard work plus smart work that will lead to success. So definitely research has its own beneficiency in the scope of student or in the scope of professionals to get update themselves and reach to the higher level as possible. If you don't do research, what would happen? You would be like stagnant. Your knowledge would be stagnant. So if you keep on doing research, what would happen? You would able to get to know about the updates what is being happening, because the service what you do provide today, people would be expecting a better service after 5 years. Even though your service is giving good result, definitely people would expect a better service after upcoming years. So in this way, how can you update yourself? Not just by your communication, at least by your staff, at least by your talks. So with this, research is going to help you to how to upgrade yourself. So definitely it has an important role in the field.
Sir, and the number of publication.
Yes, there is a difference between quantity and quality. As a novice researcher, people would look for a quantity. But when you become an experienced researcher, definitely quality will come to the place. Because nowadays, what happens when nothing is happening, something is better than nothing. So, what is happening? You do something and you do publication. So, in a sort of doing publication, we do most of predatory publication. What is predatory publication? It is called false publication. So, it is an insult to our, as a researcher, it is an insult to our profession. So, as a novice researcher, it is okay, you can do something, but as you gain experience or as you gain knowledge on your research, you must do good quality research. So quantity for novice, but quality for your experience. So better go for quality rather than quantity.
जैसे सर अभी यूट्यूब और इंस्टाग्राम पे बहुत सारी ट्रीटमेंट रिवील हो रही है।
Yes.
तो जैसे पेशेंट भी खुद अभी यूट्यूब पे देख के सपोज शोल्डर पेन है तो अप्रोच शोल्डर है, नी में पेन है तो वो ये नहीं है कंसिडर करके यूट्यूब पे एक्सरसाइज कर रहे हैं। वो कहाँ तक एज अ जनरल पॉपुलेशन के लिए आप क्या मैसेज देना चाहोगे?
Look, as the Google has arrived, and especially after the post-pandemic, when it became lockdown syndrome, and people started using more of believing the Google or Google as a doctor. So what do? They believe more on the reels, Insta reels, or YouTube shorts, or YouTube videos, and where they can get treatment out of it. It is nothing but it is just calling how to gain the emotion. So if you are a good counselor through your video, if you can counsel someone through your video, definitely your like the patient would follow your video and patient would do that. So rather than showing to a good expert who can actually guide you what are you supposed to do. So it doesn't mean that you would continue that. If you get result, that should be better. But if you don't get result, please consult to a doctor. Even if you are getting result, you may not get the side effect, or if you may not aware of what harm will you get at the current point of time. But if there is any harm which can occur after the later point of time, for that definitely you need to consult to a doctor or consult to the expert. So we cannot be claiming that we are the smartest, and we cannot be a doctor just by Google or just by YouTube. So definitely there are experts those are doing hard work of 10 years, and you are just 10 minutes of time you will tell that you are claiming you that you are a doctor. So that is completely having no sense out of it. Yes, as the YouTubers or the counselors, they are able to gain the trust of the patient. That is why the patient believes on them, and sometimes they get result out of it. But without knowing the hardness of it, and without knowing the side effects of it, and when to do, when not to do of all these things, because all diseases are not same. Even if the patient is getting back pain, and another patient is telling that yes, I also had back pain, I followed all these methods, and currently I am feeling better. So it is no guarantee that you will also feel better. Yes, you might get better, but you don't know what problem you will be ending up with. Okay, so in that case, definitely you need to be consulting to your doctor, and credit goes to the YouTube counselors. How do they counsel the patient? So just for their name and fame, they counsel the patient, and they are least bothered of what the patient is suffering of. So you should not be getting more into your YouTube or other Reels videos without having your expert consultation or your subject consultation.
पेशेंट को भी थोड़ा सा देख के
Yeah,
ही
patient also should be having more awareness. And what happens when the awareness is increasing rather than believing on the experts, we are also believing on the YouTubers. So here, as an individual, you need to create a balance. It is not like blaming YouTubers or giving trust or giving credit to the doctor. Sometimes what happens, the doctor also gives misguidance and YouTuber gives the good guidance. This is nothing but a human error. Humans can never be 100% of sure, 100% correct. So human error is there, but as an individual, we need to be balanced in our Google doctor versus real doctor. So there we need to bring the changes.
yes sir, सेम कंडीशन बट अभी फिजियोथेरेपी स्टूडेंट्स के लिए जो अभी रील्स तो बना रहे हैं, यूट्यूब पे भी वीडियोज आ रही है, बट फॉलोअर्स के चक्कर में या फिर फेम के चक्कर में, मतलब कुछ कुछ अभी ऐसे अकाउंट है जो आपकी पूरी आर्टिकल के साथ पूरी ट्रीटमेंट रिवील हो रही है, मतलब हमारी, जैसे हम अगर एमबीबीएस के साथ अगर कंपेयर करेंगे, ठीक है मेडिसिन पता है आपको, बट कौन सी कंडीशन में कितना डोज देना है ये सब डॉक्टर रिवील नहीं करते। तो हमारी फील्ड में ये थोड़े दिनों से ये चालू हुआ है कि ट्रीटमेंट हम आर्टिकल के साथ पूरे प्रूफ के साथ पब्लिश कर रहे हैं, एक्सरसाइज विथ रिपीटेशन।
Yes, sir. So to answer this question, I would go back to the previous question what you have asked. What scope does physiotherapy has on it? Yes, physiotherapy. What scope it has on it? If you compare physiotherapy or if you see the scope of physiotherapy a decade ago, it is like giving some machines and doing some exercises. But nowadays it has all changed. That what specific exercise to be given and what specific outcome to be gained. Okay, so in the upcoming scope of physiotherapy, what would happen? All these people, they will completely or they will gradually get vanished, because if they don't know how to identify a problem, rather than giving a by default treatment, a patient comes with heel pain, I have this treatment on my mind, so I'll be giving this default treatment to the patient, which is not going to work in the upcoming years. Nowadays people also are getting the awareness. If you compare decade by decade or year by year, the awareness is coming. So when the people also will get the awareness, they are also rejecting some of the therapists that yes, you are not aware of all these conditions, you are still following the old school of thought. You have something in your mind, by default you are following it, you are not identifying my problem. Okay, so these things will be evolving as a physiotherapist. Some people have already achieved, but some people, those who have achieved, they don't do this much of publication, or this much of publicity is not happening for them. Publicity is happening those who are having only old school of thought. Or what would they do? They would select some technique, they would learn some technique, they would learn one technique and they would start applying it. So here what are you supposed to do as a clinician? You should be, and this is a message to the audience also and the population also, those who are willing to seek physiotherapy service, you should be knowing patient centered approach versus technique centered approach. So when as a clinician, what we have, we do not have an analytical skills, or we do not know how to approach a patient, we become a technique centered therapist. Technique centered therapy means I am confident in giving this type of treatment. So any patient comes up with, I'll be giving this type of treatment. Whether the patient requires or doesn't require, that I do not care. But I have completely set my mind that okay, I am going to give you only this set of treatment. Whether you develop, whether you increase your symptom or decrease your symptom, the therapist has no role on it. That is called technique centered approach. But what we need to practice is your patient centered approach. Patient centered approach क्या होता है उसमें, like you are supposed to select a set of treatment what the patient requires, not what you know. Currently this is happening that I know this technique, so I'll also follow this technique for this pain, or this technique for this problem or this patient. So but that is not going to work in the upcoming days. The patient also going the, I mean, getting the awareness. So here they will also know I have this impairment, and for this impairment what treatment I am supposed to get, not what technique what I know I'll give the same thing. So here what happens, as a clinician we need to develop as a patient-centered approach. What your patient requires, give the treatment accordingly to them, not that what you know and you are going to give the same to the patient. So this is how it can be differentiated, patient-centered versus technique-centered approach.
Yes, sir. Just last two questions, sir.
Okay.
बस as we know, sir, as a sports physiotherapist aspirant in India, like everyone wants to be a sports physiotherapist of Indian cricket team, and other than any IPL team, everyone wants that. Is that possible to stay in India, work in India, and to get that position, or we want to do our mandatory certificates from foreign? Does it possible in India?
Yes, it is definitely that they could want a good name and good fame. They want to be the part in the because everybody wants to be the part of a organization which is already has achieved a set level of height. So IPL according to us that yes, this is the set level of height where everybody wants to get an opportunity. But IPL also has set its standard who is screening and who is taking that. But when you call, like take the option of visiting to the other countries and working as a physiotherapist, the same way in India, other countries also have saturated of all the fields, not only physiotherapy, there is saturation of all the fields in accordance with the physiotherapy. So what happens when you visit as a physiotherapist, you don't get job there. You have to do a odd job there. But those who have a good contact, those who have a good luck, what would they do? Or those who get a good scholarship, what would they do? They get a extra certificate from there. And through that, one connectivity would be there and you would get a chance to work there. Otherwise, with your extreme talent and with your extreme connectivity, you might get an opportunity. Yes, definitely, everybody would want that to work in an organization which has already set his heights or which has already reached to a level. But to get that, we have to keep on doing hard work. Even as you know, they don't take freshers. They are also expecting some experienced candidates. So you need to prove yourself that how you are different from others. So with your skill, with your approach, if you can prove that you are different from others and you have that so-called good certificates and so-called connectivity so that you can reach to the population, then definitely you also would get a chance. But if you see the people, those who are getting chance in the IPL, they are not staying for a long period of time. Just to get a tag as a prefix or suffix that I was a team physio of that particular IPL team, they are going to be the part of it, but not for a long period of time. Just to get the name and fame, they are going to be the part of it.
सर बहुत सारे जो मैंने आपसे पूछने के लिए बोला था कि मतलब स्टेप्स क्या होंगे, मतलब कहाँ कौन सी डायरेक्शन में हो, अगर हम सपोज आईपीएल की टीम मेरा फाइनल है, तो स्टेप्स मेरे कौन से डायरेक्शन में होने चाहिए?
Yes, so if you want to represent a state team or a national team or an international team, the first thing is that you should be entering yourself into sports physiotherapist and you should be working as a sports physiotherapist. And you should develop your own image and own uniqueness, that how you are different from others, not just by connectivity, not just by name, through your services. So your patients and your authorities, they will recognize you and definitely you will be able to achieve this. So what are you supposed to do it here if you want to get yourself into any, I mean, national or international team? You make yourself into a sports therapist, any team, and keep on practicing, and keep switching to a good place. Keep switching to a good place. And one more thing I would like to point here, like if you wish to become a sports physiotherapist, first decide which sports belongs to you or which sport type physiotherapist you are going to belong to. Like you want to be the sports physiotherapist of Indian national football team. So in the first itself, you should be into the football team. Or if you want to be the Indian archer physiotherapy. So first only you should be into the archer team rather than trying with different sports and getting into the archer, that would be difficult. So first itself you should be entering into the sport which you are aiming of or which you are dreaming of. So keep flourishing in that aspect and definitely when you can make into that part.
So sir, what would be the final message to the physiotherapy student or who is practicing clinical?
Okay. Regarding like message, how do they succeed or what the future goals?
Succeed
Okay. So to the physiotherapy students, I would say that be focused, be specific to your skill. Be specific means like nowadays what we call physiotherapists are being like separated by their specialties like neurological physical therapist, orthopedic physical therapist, sports physical therapist, pediatric physical therapist. There are different domains out there. So even though you belong to a sports physiotherapist or an orthopedic physiotherapist or neurological physiotherapy, be a joint specific, be a regional body specific, or be a condition specific physiotherapist. So that would give you more name and fame there rather than a generalized physiotherapy because nowadays people are more specific. Like if you have an iPhone and you want to repair it, you will not go to the shop where all the mobiles are getting repaired. You are going to visit a specific shop where only iPhone are only being repaired. So all the field has come to the saturation that we are only specialized people. You want to have a neurosurgeon or you want to have get a neurosurgery done, then you have to visit a specific type of doctor who treat a specific impairment rather than visiting a generalized neurosurgeon. So every specialty has become their subspecialty. So my message would be to the students or the future community would be that be specific as much as possible. So which would get you your name and fame, and keep focused, keep enhancing your skills, keep sharpening your skills, and keep shaping your skills. Once you have achieved a skill, you have to keep on sharpening, like how a warrior does. He keeps on sharpening his bows and arrows. So similarly, as a physiotherapist or as a professional, what skills we have achieved, we have to keep on learning new skills as much as possible. But those skills what we have learned, we have to keep sharpening and keep giving a good shape to it. So that is how we can develop, or we can be also part of a good team or a good community of our field.
Okay, sir. Thank you so much, sir.
Thank you. Thank you for having me today. Thank you.